Just a little anatomy lesson. There's 4 ligaments in your knee. There are 2 on the outside called the collateral ligaments.
Sorry. Go ahead.
Which are on the sides. And those are actually the inner one called the medial collateral ligament. It's the most commonly sprained ligament. Doesn't need surgery, gets better with some physical therapy and tincture of time. Unfortunately, they do take some time to feel better. They don't get better in a week, which is what everybody would hope they would do. And then inside the knee, there are 2 ligaments called the cruciate, which means cross in Latin. There's the anterior and then the posterior. And the anterior cruciate ligament's torn 95% of the time versus 5% of ligament tears approximately are from the posterior cruciate ligament. And this ligament is very important because it provides stability and your ability of your knee to rotate when you pivot and twist. So the reason that girls do in fact tear their ACL more commonly than boys, and it is an epidemic, and it's about 5 times to 6 times more common in girls than boys, is because some of it, they think, is because of our anatomy. Historically, it was thought because we had wider hips and we had more knock knees, but in fact, it's probably related to not only the difference in strength in your quadriceps and hamstrings and your glutes, but also about how we approach the ball when you strike the ball. Women tend to land with their leg in full extension and then turn. So it's better to if you watch men's soccer play, they tend to turn and pivot with their knees slightly flexed, and it's just the difference in the anatomy. And so what happens is that a lot of the prevention work that's being done really focuses on teaching girls how to strengthen their butt muscles, their glutes, and their hamstrings, so that when you go to pivot and twist, that you're not as likely to tear your ACL. The same thing for basketball players. It's how girls land with the legs straighter. They don't land with their legs bent, and so it's called soft landing. So there's a lot of work there's programs for pre-season prevention of injuries in basketball for how you land. So it is a much more common injury.